away over the forearm, then you're going to need to work your way down to the retinaculum and clear away, break through the retinaculum on both the extensor and flexor sides. And the reason I want you to do that is because in order to identify the muscles that you'll see, you need to follow them out to their insertions. So, most of the extensors are coming from the lateral epicondyle, and most of the flexors on the forearm come from the medial epicondyle. So their origin doesn't usually help you very much, but the insertion is critical. And so as you work distally, the best way to do this, and some of you will have fascia that's more opaque and it's kind of difficult to get started. But once you start separating or clearing away the fascia over these muscles, identify the tendons, these shiny strips here, and follow those tendons and use those as guides to get through the retinaculum. And again, if your fascia is really opaque, you're probably going to have a pretty tough fibrous retinaculum around the wrist. And we want to break through that so that we can start to separate the muscles a little bit and follow that separation through the wrist and out onto the metacarpals. And the first one we want to identify, probably the most central. It's not being very cooperative here. You do want to try to be careful that you're not getting your forceps under the tendon and shredding the tendon. But the most central muscle on the extensor side is going to be a muscle that has a tendon that separates and runs out onto 4 of these digits, 2 through 5 usually. And unfortunately, these tendons are really thin out in the hand, so it's hard to really see those. A lot of yours will have really obvious, thicker, shinier tendons when you get out towards the insertions. But this muscle is the extensor digitorum communis, because it's going out to all those digits. And right next to that, just lateral to it, is an extensor that usually goes to 4 and 5 here. And that's the extensor digitorum lateralis. And you can see how that's restricted to this lateral side of the hand. And then you can see the extensor carpi muscles. There's an extensor carpi ulnaris, whose insertion is stopping here at the ulnar head and the lateral metacarpals, and the extensor carpi radialis, which has a couple of heads, but they come together to insert onto the distal end of the radius, or just past the distal end of the radius. And so those are the most superficial muscles that you see on the extensor side. Extensor carpi ulnaris, extensor carpi radialis, extensor digitorum, and those don't go into the hand. They don't go past the wrist. Extensor digitorum communis, extensor digitorum lateralis. Now, once you get those tendons kind of freed up, then we can look at the deeper muscles, and I think I'm going to bisect this extensor digitorum communis so that we can peel it back. And I'll cut it up here. And if you bisect your forearm muscles and you do cut through more than one of them, it's a good idea to stagger your cuts here. So when we're cutting through thin or kind of narrow muscles where there's a lot of them, if you make one cut here and another cut staggered a little bit, then it's much easier to put them back together and to see who goes where. And that'll be the same when we get into the leg next week. But underneath those muscles, we see muscle that sits right over the bone. So this is the radius. And if we look at this muscle going on to, let me clear up communis a little more. There is a deep muscle that goes from the lateral epicondyle out onto the radius, and you can sort of see a gap along the radius, diagonal gap along the radius, and that represents the end of the insertion of that muscle. So it just comes right down onto the radius, and when it contracts, it's going to pull the radius laterally. So contraction of that muscle is going to pull the radius like this, which is supinating the hand. And so that's the supinator. And then from that insertion, that diagonal line we can see right here, there is another muscle which is running along the surface of the ulna and radius. And it's hard to see yet, but the fibers for that muscle are collecting over the radius, and they run down the medial side of the wrist out onto the first digit. And so these are the abductor pollicis, that's the abductor pollicis longus. And what you want to be able to see for that, to recognize it and understand it, is that its origin runs across here, and that it starts to form a narrow band that goes out here toward the thumb. That's not totally visible yet, but it's going to run out like this. Okay, I think that's all. No, that's not all. We have a couple small muscles that lie just lateral to the abductor pollicis longus. And pollex is thumb, by the way, and so that tells you that it's abducting the thumb. So it makes sense that it's running across this surface. You can see a little tendon here, a narrow tendon here, and a little thin muscle that's attached to it, a strap of muscle. And if we clear away that tendon a little bit, we can follow it out to the wrist. And this is kind of a dicey one because this one is so small. But this tendon runs out onto the wrist sort of laterally, and then once it gets to the wrist, we can't see these on this guy, but the tendon is going to head medially to the first and second digits. And so this tendon is the extensor digiti 1 and 2. And it doesn't run, the abductor runs across the medial side, and this tendon runs down the top to the thumb, digit 1, and to the index finger, or part of the paw, digit 2. And you can clean this up a little bit to see those. So you've got abductor pollicis longus and extensor digiti 1 and 2 right over the surface, the extensor surface of the radius and ulna. Now on the flexor side, we want to do the same thing, get through that retinaculum. And it looks like these flexor tendons are a little more visible here out in the paw. But again, we'll start with the most superficial of these. Trim that away a little bit so we can see. And we want to try and elevate that muscle right here by the tendon. And that one also runs out to all of the, at least 4 of the digits, sometimes 5. And as we work along the sides of that tendon, we can start to free it up a little bit. And sometimes this will have additional muscle that attaches distally here onto the tendon. Don't worry about that. Might have to tear that loose to get out onto the paw. But there you can see the tendons that are branching off from it. And that is the flexor digitorum superficialis. So it's kind of like the flexor version of the extensor digitorum communis. And the reason it's called the superficialis is because it lies superficial to another big flexor that goes out to all the digits. And that is the flexor digitorum profundus. So we have to go through additional layers of connective tissue in the carpal region to try and free up that muscle. And to see that, I'll pull superficialis out of the way. And one thing I want you to do is to find, there's a big tendon, a plate, flexor plate that forms the tendon that goes through the wrist. And if you can liberate that, you can see the size of that tendon. So that's the deep flexor plate that comes from muscle fibers of the flexor digitorum profundus. And flexor digitorum profundus has multiple heads, 5 of the heads they identify in this book. And you don't have to be responsible for the names of the individual heads. I'll want you to know that if there's muscle fibers that are going to this flexor plate, it's all part of flexor digitorum profundus. And so you can clean that up a little bit more so that we can move that around, because we're going to use that to look, there's some deeper muscle still, and we can use that to separate flexor digitorum profundus from the other flexors that we have here. So similar to the extensors, we have a flexor carpi ulnaris that goes out here to the ulnar styloid process, or lateral styloid process in the cat. And we have a flexor carpi radialis, which I haven't completely cleared away yet, but is this muscle right here, whose tendon runs out to the distal radius. And then around that, next to that, these are heads of the profundus. So there are heads that come off the radius, there are heads that come off the ulna, and heads that are attached to other muscle groups. Now, if we look at the flexor carpi radialis right here, there is a muscle that looks like it's a head of that or a part of that, except, so it's coming off the medial epicondyle, and it is inserting along the middle of the radius by a kind of a sheet-like tendon. So we can see this muscle right here narrow down, and then it doesn't make it all the way to the end of the radius. It doesn't make it to the wrist, but it's inserting along the shaft of the radius. And this muscle is a pronator because it's going from the medial epicondyle to the radius. When it contracts, it's going to roll the radius medially and pronate the hand and wrist. And so this is pronator teres. And we have two pronators in the forearm. Pronator teres is up here. And there is another pronator that is deep right on the surface of the ulna and the radius. And it runs from the radius over to the ulna or vice versa. And you can just see it as dark muscle tissue underneath this shiny fascia, this antebrachial fascia that attaches the radius to the ulna, an interosseous ligament that I'll talk about a little bit in class. And that muscle tissue is going transversely from radius to ulna. So when it contracts, it also is going to pull the radius, the distal end of the radius, over in a pronating position. And so that's the pronator quadratus. And that's deep to this flexor digitorum profundus. So you've got pronator teres and pronator quadratus. And they also talk, they mention lumbricalis, and there are a number of different muscles in the hand itself. And the lumbricalis are muscles that you can sort of see once you clear away the connective tissue around these tendons out in the metacarpals. And they're muscles that attach to the metacarpals and attach to these tendon sheaths. Now, one interesting thing about the flexor digitorum groups is that the flexor digitorum superficialis inserts onto the proximal phalanges, and so it bends, like in ours, it bends our fingers at the first knuckle. Flexor digitorum profundus runs through, the flexor digitorum superficialis tendons split at the phalanges, and flexor digitorum profundus runs through that split and goes all the way out to the terminal phalanges. So in the cat, it inserts on the bone that has the claw. So when cats have their claws retracted, they pull with their extensor digitorum to pull the nail, the claw, back up into the fur. And then when they contract the flexor digitorum profundus, it flexes that terminal knuckle, and that pulls exposes the claws out. So when they're climbing or fighting or whatever, it's flexor digitorum profundus. And then when we make a fist, we're curling our fingers with flexor digitorum profundus, but we're holding the digits in with flexor digitorum superficialis. Okay.